Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barela. On this program, we explore health issues that are prevalent in the White Mountains. Today's topic is drawn from the Community Health Status Assessment that is driven by the Navajo County Health Department. Our topic today is children with special health care needs. Today we have wonderful guests that include Allison Hefner, Outreach Coordinator from the Navajo County Health District, Kelly Porter, a mother of a child with special health care needs, and Barbara McMasters, also a mother of a child now with adult special health care needs. Allison, I'm going to start with you because as the Outreach Coordinator for the Navajo County and trying to do the assessment of needs, why don't you talk about children with special health care needs and the program that we are now involved with?
Okay, this grant came available to actually survey Navajo County, and it's to promote the survey, and I went and I grabbed it and said, okay, I know that we have some deficiencies when it comes to children with special healthcare needs. And we're talking healthcare needs from behavioral all the way up to cerebral palsy, from autism to, what is it, like, what we call asthma. Asthma. Simple, to more simplified to complex. I mean, it's all children. We need all parents to take this. But we only have data at a national level. We don't have local data to support funding coming to us, support strategies coming to us. So there's a big issue there. Right now, nationally, 300,000 children have special health care needs just in Arizona, but we don't know where their children are. We don't know where to, we don't have accesses because we don't know that this is a need right now. You have to have proof on the paper. Which is sadly, you can have as many squeaky wheels as you want, but if you don't have proof on paper and data to support we need these, you're not going to get the help or the strategies in place. So through this survey, getting every parent between 0 and 17 to take this survey will bring data in that we actually now can say, look, these are the issues. This is where we need to focus our efforts. We have a deficiency in doctors, or we have a deficiency in this for kids with special health care needs. We have proof that we have this. Now we can go out and get the grants. Now we can go out and get the funding. Now we can go out and get the Board of Supervisors, the city officials involved in focusing on these strategies, even the hospital. It's very exciting. We have this thing called the CHA, the Community Health Status Assessment. That's where this data goes into. Once the CHA is complete, which we will be revising in 2017, this data will come right before the CHA gets revised. That means this data will go into the CHA. The report will be part of the CHA. Summit Healthcare uses the CHA. Navajo County Public Health Service District uses the CHA, and this is what we do. We look at the CHA and we say, okay, where are our priority issues? Where do those lie? What are the biggest issues we see? Well, our previous CHA, there was 4 issues, and we've gotten hundreds of thousands of dollars focused towards those 4 issues. We've gotten committee after committee focused to fixing those issues, and it's happening, and we're moving forward. So if we get this data, everybody takes this data goes in the CHA, we actually can focus on this. We actually can get the money to fix this. There's a light at the end of the tunnel when it comes to parents and children with special health care needs. That's why this is so important, and that's why I'm advocating for it. And I thank you for having me on the show today to talk a little bit about it.
Wow.
I love her enthusiasm.
It's like,
I can see the enthusiasm in our guests who have been through it. So in terms of data and data that we know, there must be a lot of unmet needs among children, I suspect adults too, because I think Mrs. McMasters will tell us a little bit about her boy. But there's a lot of data in terms of unmet needs, and I think the data would indicate that over 50% of parents indicate, actually almost 60% of parents indicate that their needs are unmet. Does that seem reasonable?
Mm-hmm. Oh, yeah.
Correct. Yes.
Yeah, it seems reasonable. So we're going to come back to your talk here a little bit in terms of data and stuff like that. I want to spend a couple minutes here, more than a couple minutes, hopefully, talking about your children. Kelly, you have a young boy who has special health care needs. You have been up here. He was born up here?
He was born up here.
Well, he was born up here and is now...
He's almost 13.
Almost 13 years old. He has some very special needs, some up here, some elsewhere. Can you tell us a little bit about his needs and maybe some of your frustrations?
Yeah, you know, he's born with cerebral palsy. We haven't had the healthcare need. We haven't had our healthcare needs met in, I bet, 5-6 years. Whenever he gets sick, we have to take him down to Phoenix Children's. We found a pediatrician up here, but he doesn't have the rights to the hospital, so it really does us no good to have him be so sick, but yet we can't take him to the hospital because he can't see him there.
That's a problem, isn't it?
That is a big problem.
Now, at one time, there were more pediatricians up here.
Yeah, we had plenty up here.
And were your needs met at that time?
Extremely met, yes.
Okay, so at one time, at least that need was partially met, but you still couldn't meet all your needs.
No,
I know even when you had a pediatrician.
There were times
up here.
where it was beyond, you know, anything up here, so we would take him down there, surgeries and stuff like that. But for the basic needing to be in the hospital for being sick, it was fine. But
okay. Now, from Allison's standpoint, at one time up here we had in the region, including Springerville and Holbrook, we had 7 pediatricians up here now. But my understanding is that now we only have 3 pediatricians up here, and that has impacted you in the last 3 or 4 years.
You know, it takes a lot to trust somebody with your kid when they have such needs, you know, and when you don't feel that connection, it's hard to.
So you say that one of the things maybe that you've missed is the bond.
Yes.
And there, when you have a child with special health care needs,
you have to have that bond.
You have to have that bond. Would you say that that's true also?
Oh, very much so. And Ryan is now 27. We didn't move up here until he was 17. So my experience up here is a little bit different than Kelly's, but we went through a lot after moving up here. A lot of it had to do with the lack of educational services compared to what we were able to access in the Valley. But he had considerable health needs too, and they impacted his behavior horribly. So we went through a lot there, and we ended up having to go down to the Valley for special services to the Center for Autism to meet those needs. And besides the fact that the travel is always an issue. I'm fortunate in that my son likes to travel. I know a lot of people that have autistic children find it very difficult to travel. But also, everything that we did for him at that time was not covered by insurance. So there was a tremendous amount of out-of-pocket, and I know a lot of other families have experienced this too. In the lifetime of an autistic person, I know millions of dollars are spent between what the family spends and then of course what the state spends. It's a very, very expensive endeavor. And we have been fortunate in that we have found a doctor, but he's an adult doctor up here, and Ryan has bonded with him, so I'm very happy for that. But there are other areas where things are greatly lacking. I think, if you don't mind me discussing the educational aspect right now, the schools, I feel, and I'm not faulting them because they are burdened with everything under the sun, but they seriously are lacking in terms of understanding what needs to be provided for some of our children. We don't have good behavioral therapists up here to speak of. It's my understanding there's only about 80 in the whole entire state of Arizona that are working on a full-time basis. There are others that do a little bit here and there. We need more training for the school districts so that the teachers can feel comfortable with children like ours, because autism, although it's a developmental disorder, it's highly behavioral in terms of the way you need to interact. There's just a ton of behaviors, and oftentimes the parents feel isolated. We had a horrible experience up here, and I ended up homeschooling Ryan for a couple of years. I'm a special education teacher, so it was, really not that much of a stretch for me, but I felt very isolated, and I think that happens all the time.
For sure.
And you probably experienced that too.
And I want to get to Derek's issues too, but it's interesting. For a long, long time, there was a disconnect between the medical issues, mental issues, and education issues, and in the 80s and 90s, of course, that became more the forefront as legal issues began to invade the school system to provide educational services for both Ryan and for Derek along the way. And it's interesting that you bring that up, and we listen to the difficulties there. One of the problems is, of course, that we note on the surveys, at least on the previous surveys for yours that you've given me actually information from, Allison, is that about 60% of parents feel that there's a disconnect between themselves, their doctors, and the school system. Mm-hmm. The medical home concept that is being utilized to try to help children with special health care needs on a national basis, my understanding tries to approach it that the doctor, the parent, and the school are really a team. And if you miss that, have you seen that to be true for Derek's case too?
For sure.
Okay, because Derek has a lot more medical issues. Right. Does he go to school? He goes to school.
He has a one-on-one aide. He goes from 8 to 2. But as of when he's there, I'm not sure what all is getting met, because I have a planner there that they're supposed to sign when they come in to work with him, and it's not getting signed. And so that's my other concern, is the lack of therapy. You know, like, I just don't, I wish we had more in the home. I wish we could get more at school. He's been on a waiting list for OT and PT for years.
That's not right.
Yeah, and he's not getting anything. He has speech at home, but as in the OT and PT, he's not getting any of that.
At one time, it seemed to me that we were even receiving PT, OT, and speech therapies out of Flagstaff here.
Yes, they've traveled to my house before.
And because of local resources. So here clearly for your survey, a need that goes even farther. But in all fairness, speech, physical therapy, and occupational therapy needs are really broader than just locally here in Show Low. I think if you talk to parents in a lot of places, they would indicate that those things are an issue. And I think first things first, and through some of their program needs for children under 5, have that issue on their plate also for training of more speech therapy and stuff. But granting is a big issue.
If I could interject here, my son has learned to use an iPad because he has apraxia and he has difficulty forming words. And it's really heartwarming because the speech pathologist said he's learned it faster than anybody she's ever worked with, and he loves it. But she comes out of Flagstaff. And, you know, in my work, we also work with therapists, and almost all of them come out of Flagstaff. So we have a real drought here locally, and we should be finding ways to attract them.
Absolutely.
Because there's such a huge need.
What is there to attract them? I mean, is it money?
And that's that's other things that Navajo County Public Health is doing. Like I talked about earlier, I am doing a physician retention survey. I'm asking the physicians and their wives, how can we keep you? How can we get more of you here? Because we need special healthcare needs doctors. We need people to fill those gaps, and we need a lot because they're not even being touched.
Right.
And so one of our goals, and that came from the last CHA. So we're focusing on that right now, and we have money going towards that right now. That's why I said it's so important if people take this, because we actually can work on this. I mean, I would love for you both of you guys to be part of the committees. I mean, I'm listening to you, my head's turning. I'm like, oh, I can't wait to get this data. I can't wait to start on this project because we can actually help the community here.
Right. Yeah, for sure.
That's great. I'm like, oh my gosh, it's the beginning. This is the beginning of a wonderful thing.
If only she liked what she does.
I love it. I love it because I can help.
If only she were more enthusiastic.
Really?
If only she were more enthusiastic. It's interesting that you say that. CHA-type surveys were done in 2005 and again in 2010. And it's interesting when you look at parents that talk about their unmet needs in those 2 surveys, there was really no change between 2005 and 2010. Still, about 60% of parents had their METs on need. unmet.
Right.
And so in the 10 years or so that you've been here, and the 12 years that your boy is up here, just take a second while I talk here. Think about maybe how things have changed, better, worse. I don't know. I don't know about that. And it's important for your survey now to see if there's been progress or whether things are going backward. I think I heard from you about the issue for receiving medical care for Derek and how difficult it has
Oh,
been.
it's almost impossible. You know, I just feel like I'm drowning almost. Like I have nowhere to go. Nobody to talk to about things, you know, like, I don't know. It's just getting really hard. It's frustrating.
It's frustrating. And in all honesty, you're a very very great advocate for your boy and autism, I know, for services. And what you found in the Valley for autism services is really unusual, and it's only regional in the country.
Right.
So we would not have those services. But the other issue is, have people up here helped you find resources when you've had difficulties?
I think we've probably both been a little tenacious on our own.
Right.
You know, it's like you feel like you are on your own and you have to dig them up. I think one of the frustrations that I've had over the years is we had one amazing doctor up here. I think you know who he is. But in trying to find services through other doctors, they're usually very traditional in what they look at. And we've kind of gone outside of the typical box to find things for our son, and they've paid off, although some, of course, have been a bust. But you know, we've always continued to search. But I still say that financial considerations are just overwhelming for families, and even though doctors are becoming more knowledgeable about autism and recognizing it because it's so prevalent now, still a lot of kids are really missed, and the families aren't getting the services they need. So, you know, in my case, I feel like we have been able to get Ryan what he needs, and he is in a good place right now. He's living in a group home. It's just a couple blocks away. My husband always says just long enough for the cord to reach. So, you know, it's wonderful. That's right. That's right.
The mother cord.
But, you know, we know that in the years to come, with the prevalence of autism, where are all these young adults going to go? I mean, where?
Certainly the transition to adult. But interestingly enough, for your boy, the issue is also a very difficult issue for transition.
Oh, for sure.
There have been hundreds of projects nationwide to figure out the transition for children with special health care needs to adult physicians.
I just feel like I'll keep him the rest of my life, you know? Like, I don't know where I would send him. I don't think I could do it, but...
Well, it's not a matter of sending. It's just, you know,
I don't think
medical resources are so
let
important.
him go, though. You know,
Well, I know how you feel because I went through that. But interestingly enough, if you don't mind me mentioning this, we thought the transition would be horrible for Ryan. And we did it because we are getting older, and we're not going to wait until we drop dead and then have somebody swoop in and take him and put him somewhere. So we wanted this to be a nice facility, and it is. But it took Ryan one night to adjust. I'm the one that had difficulty, but he did very well.
In one night?
Yeah, he did. He adjusted just like that, and we were so amazed. We were just absolutely
and
lucky.
how severe is he? I mean, he can walk and talk and all that, right?
Of course, yeah.
Yeah.
But as Dr. Barela knows, he definitely has some serious issues in how he looks at the world and just how he absorbs information.
Well, and medical care for your boy is also a very difficult issue. Do you find that when he gets sick and stuff like that, you're in the Valley?
We're in the Valley every time. We go down, we just take him.
And that's, of course, a change in the last few years because you used to have him hospitalized.
Yeah, he was up here quite a bit.
Yes, and so the bottom line is that the medical care not only makes a difference related to the school system, but you know, one of the things that parents talk a lot about when they have a child with special health care needs is the out-of-pocket costs because they don't have services. And that seems like a bigger issue up here, maybe?
Well, We always had a lot of that because insurance didn't cover what we did. For instance, when Ryan was little, we had the first home-based program in Phoenix out of UCLA. Well, nobody covered that. The state didn't cover that. Insurance didn't cover that. Later, they actually started to cover those services, and now it's my understanding that a lot of it's being covered.
Yeah, that comes out to be a legislative issue in terms of what's provided for that and stuff like that. But yours have been more medical, Kelly.
You know, and we've been fortunate. I mean, all of his medical stuff's been covered.
Right.
You know, but, you know, it's just the other things, you know, just the gas money down in the valley, hotel rooms, food, everything else. Because when he's in the hospital, it's usually a good 10 days at least. And so, you know, it's those things that people don't think about that's killing your bank account because you have to pay for a hotel room every night. And, you know, it'd be so much easier if I could just keep him here, but the care is just not here.
Okay. So has care improved up here? Well, from your standpoint, it hasn't.
No.
Only because the medical backup has
correct.
Not
you know,
been
and there
there
were times we'd be at the hospital and I'd have to teach them how to do his pump. You know, they just aren't educated on just those things that.
And that's not an unusual complaint of parents with special health care needs.
We ended up bringing everything from our house to Summit so he could eat and so he could have his medicine and stuff like that.
Yeah, and a lot, but in reality, that's not unusual because you always know your kid better than anybody else does. And that's always been a problem with the medical system because, you know, sometimes doctors don't listen to parents.
Shame on them.
They should every once in a while.
They should. So I want to go through some of this. This is some data, and you may want to talk about it, or I can. When the American Academy of Pediatrics put together their program for the medical home and children with special health care needs, they collected data from all over the country, research studies. And so I want to get your impression. I'm going to go through this list of some things here and kind of talk about from your experience and maybe from your learning for your survey.
I'm learning.
One of the things that they said here is that having a primary care medical home with an experienced physician is essential for proper care. Do you think that has that been your experience too?
Well, I agree with that statement, but I'm not sure I've experienced that.
Right.
So,
Well,
would be nice.
I mean, I feel that we do have a good support system right now, but I'm just thinking back over the years, and it was a struggle. I think you're probably in a better place to relate to that.
Read it one more time to me.
a primary care medical home. That really means having a doctor. The concept is having a doctor that you can go to and he will coordinate your care. 60% of people say that their doctor does not coordinate care with the school, with the specialists, and it leaves parents running around. If you don't have a medical home where you can go to one person, you know.
I bet it's been at least 5 years since I've had that.
You had to build your own support structure.
Yes, exactly.
And you already have all this.
Yes.
Yeah.
Okay. Decrease in the amount of hospital days if you get.
Oh, they kick them out.
You know, and when you have a proper home with a physician, the drop in unmet medical needs drops 72%, up to 72%, which means you're getting that 60% drops down to 28%. 30 to 50% drop in emergency room costs. In other words, if you can manage things with someone who understands it, this is the reason why the assessment is in there. Fewer missed school days. A difficulty if you're a working mom or a working family, okay? Less out-of-pocket family costs. In other words, the object of what Allison is trying to do is she's trying to improve all of these areas by properly doing a local community assessment.
Where do we need to focus?
Where we need to focus and what we need to do. Okay? Is that?
Yeah, and it doesn't need to be one focus. Okay, right now we're going to do medical homes. No, we can have 4 different priorities, then 4 different coalitions that are working on this and making sure that we get you the support. It breaks my heart to see that not only you guys just need to focus on your children, but now because you don't have those needs met, not only are you focused on your children, you're building your support and you're going out there and saying, okay, how can we work together when that should be done for you?
Right.
And that's
And it's
what
true. I mean, I have 4 other kids that we leave at home when we got to go do this kind of stuff, you know, and so it wears on everybody.
Absolutely.
You know, if I could interject here, yes, I feel like my son is in a good place right now, and I'm grateful for that. But in my work, I run into families every day that they don't even know how to advocate for their children at all. They would have no idea where to go for services. So yes, I can offer alternatives, you know, help that might be available, but we're really lacking, I think.
All right.
Absolutely.
Well, this is certainly good. We're getting close to our time period. For your survey, tell people how they can help you and where they can find these surveys to fill out.
All parents with children between the age of 0 and 17, whether your child has a behavioral health problem or autism or cerebral palsy or nothing, every parent in Navajo County needs to take this survey.
And where can they find the survey?
The survey right now there'll be a link that they can see on that, and they can just copy the link and put it in there and take it from there.
And you're going to leave these surveys around at doctor's offices?
Doctor's offices. If you go on Navajo County Public Health Service District, you'll be able to see it. It's up on our Facebook page, and then it's also on Navajo County Arizona Gov.
Well, I thank you all for coming today to share your experiences, and we hope that your survey works out well. Thank you for watching Discover Health today. And please remember that healthy habits lead to a healthy life. Thank you.